honorable guests and all the governments who believe in what women are doing. Thank you, Your Excellencies, especially the men. If we didn't have the men, we could not do the work we do. So thank you again. And before I invite Dr. Rupa, I would just like to say, in the spelling of women and woman is man and woman. So that's what gender equity is and gender harmony. Thank you. And it's my great privilege to introduce Dr. Rupa Dutt, whom we all know. And she is such a passionate advocate for gender equality in global health. She's been a leading voice in the movement to correct the gender imbalance in global health leadership. She's a practicing internal medicine physician in Washington, D.C., and currently also holds the title of assistant professor at Georgetown University. And Rupa was determined to build a movement to transform women's leadership in health. And she co-founded the Women's Global Health in 2015. I know her since 2016. So it's been a privilege knowing you, Rupa. And now, ladies and gentlemen, do you know Women in Global Health has 47 chapters all over the world? Yes, it's not one, it's not two, it's 47. And 100,000 supporters in more than 100 countries, and we continue to grow. Thank you. The floor is yours, Rupa. Take it away.
Thank you, Dr. Minnie, and thank you for your support. I wasn't expecting that expansive introduction, but appreciate it in a room of, I say, those that are so committed to the gender transformative agenda with us. You have already observed all protocols. Appreciate that, but we are not in the assembly, so this is a moment for us to have the really tough conversations to really move the agenda on gender equal healthcare workforce initiative. I want to acknowledge the governments that have sponsored, but particularly our co-host, the government of France, of this initiative. But for this particular event, we have been sponsored by Liberia, Norway, Brazil, and Mexico, and the United States. So again, thank you for your leadership for this particular event. On behalf of Women in Global Health, it really gives me a pleasure to welcome all eminent speakers. But, I want to ground today's conversation. We're almost at what feels like weeks and weeks and months of a World Health Assembly. We know that this assembly is a critical juncture, and we know for our honorable guests here that have prioritized this issue, this is a reality that they are facing and they're acknowledging at the highest level of their governments as a top issue, the health workforce challenges. We are facing a great resignation of unprecedented times. We know why that great resignation is happening. We know our health workers have been tested. Women make up 70% of the health and care workforce, yet only 25% of leadership roles. Yet we also know women in the pandemic have faced even a greater burden at home with added care responsibilities, whether it was of children, whether it was of elderly, or whether it was just their communities. We also know that they've had added burden when it's been in the healthcare settings with very little support from added patient workloads. I myself practiced in COVID-19, and I can't even count one health worker that did not take an extra shift or a double shift or a triple shift, worked in conditions where they may or may not have had access to PPE. We often had to change a mask and alternate the same used masks over and over because of the shortage. We know that health workers around the world became creative by using materials in their communities to create gloves and gowns and find forms of protection. We must not forget what the pandemic has done as the pandemic has been announced, an end to it. We must learn these lessons and break from the past. There are a few things that we wanted to really ground today's discussion in. We have entered the fourth year of the pandemic, and there are 3 high-level UN meetings happening. I want to acknowledge the co-chair, Dr. Precious Matoso, for being here with us. Thank you for prioritizing this issue. That this sends a strong message that every member state must pay attention to the critical issues of health workforce from a gender equity. So thank you for being here with us today. We also know that the Universal Health Coverage high-level meeting is happening, as well as the high-level meeting on tuberculosis and pandemic preparedness. So it's a very busy year for the diplomats and the negotiators. And so we appreciate you taking the time to listen, especially opening this panel from the voices of all health workers, I can say. Since the pandemic started, there is an alarming trend for health workers to leave their jobs. Burnout, moral injury, surges in patient numbers, feeling undervalued, lack of resources to treat patients have all contributed to the great resignation of health workers. Since women have been majority in the patient-facing roles, it's not surprising that they're leaving in higher numbers. We are calling the great resignation of largely women health workers in high-income countries to also lead to the great migration of health workers from low and middle-income countries. We have heard the latest data from the WHO when they released their safeguarding list of countries with critical health workforce shortages, and now going from 50 to 55 countries. So it must be on top of agenda. In 2021, Women in Global Health was proud to launch the Gender Equal Healthcare Workforce Initiative, which we co-lead with the government of France, because we recognize that health systems cannot function without the work of women. And yes, I'm going to say that again, health systems cannot function without the work of women. And Minnie, I'm going to say that while I applaud the men in this room, I have to always applaud the women that deliver health and acknowledge that. And at the same time, we recognize that the gender inequities in the health workforce, including leadership, pay, and protection, reduce the morale of women workers and also mean that health systems are not fully benefiting from the talent and professional knowledge of women. The Gender Equal Healthcare Workforce Initiative aims to inspire action for gender equity in 4 pillars. The first pillar is promoting equal participation of men and women in health leadership. Although women are the majority, the vast majority of the senior leader decision-making roles are given to men. So women only make up 25%. We released our gender count of the World Health Assembly, and while we are celebrating that there has been progress from last year, we have seen almost a 10% increase. We still know we have a long way to go. So this year, the representation of chief delegates, member states to the World Health Assembly for the first time was at 32%. That is up 9% from last year. So while that is promising, we also looked at all World Health Assemblies, over 73 World Health Assemblies. We counted every single data point from the first World Health Assembly and released this report last year. And what we found is that 85% of all those delegations have been majority men. So we have a long way to go if we aggregate that, and a long way to use this inflection point of WHO's 75th anniversary to think about how global health moves more gender transformatively. The second pillar is recognizing the unpaid work, largely done by women in the sector. The importance of equal pay. Recent research from Women in Global Health has identified that there's 6 million women in core health systems that are unpaid or grossly underpaid. And in general, women health workers earn 24% less on average than their male counterparts. The third pillar is protecting women health workers against violence and harassment. Last year, Women in Global Health launched a Health2 platform where women in health sector could lodge stories of sexual violence and harassment they had experienced in the health workforce. I encourage each one of you to check out this report. It is unlike any report you're going to find on sexual harassment because the testimonies, the stories, the personal risk that women health workers go through to practice, train, and remain health workers is one we cannot ignore. This is one of the top reasons that women do leave the health workforce is the taboo topic of sexual harassment. We must look at our institutions and make sure that we prevent all forms of sexual exploitation. And the fourth pillar is ensuring safe and decent working conditions for health workers. We will hear more about it in today's panel about personal protective equipment, the role of vaccines, addressing mental health needs of health workers, which have been a major issue during the pandemic. For us, this fourth pillar is a holistic pillar about how we really support all of our health workers from a gender equitable way. And when we do things from a gender equitable way, everyone benefits from this. These are the critical areas to address to retain women health workers. I'm going to say one other provocative thing that's not in my notes is that when we talk about health workers and we do it without acknowledging that they're women, we are doing it in a gender blind way, and that is actually harmful. It's not gender neutral. So I will call on this room, especially because I know you are the most committed, to make sure that we no longer talk about health workers without acknowledging that they are women and they're facing gender inequities. So on that note, I will pass it back to the moderator to kick off our discussions and drive the action forward. Again, thanking the 45 governments, international organizations, and NGOs that have joined, and a special thanks to the governments that have stepped up the political commitment. We have 16 governments, and the numbers continuing to grow for this initiative. Again, thank you.
Thank you, Rupa. You never fail to deliver. So thank you so much. And before I pass it on to our next esteemed speaker, mask for 5 days because the male doctors took the PPE. So when you spoke about PPE, I just wanted to add to these real life experiences which we have heard about or faced. And also to our everybody who's committed here, especially our government representatives, and we have a fabulous person from WHO, and I'm just going to ask for your indulgence, like while I give a very brief bio. And also the reason I just want to highlight these people are incredible. I know their bios are there, and Rupa has really, she's like really garnered a whole movement, and I think it's high time that you're told, and this is because you're an inspiration for everybody sitting here across. So that's the reason I did it, not for brownie points. So now it's my great privilege to introduce Dr. Amelia Latu of Wuhan Mango. I hope I got your last name right, Your Excellency, who, before joining the World Health Organization as the Chief Nursing Officer, she was the first female Minister for Health for the Kingdom of Tonga from December 2019 to December 2021, and has led Tonga's successful response to both the measles outbreak and COVID-19. And just that there was a very bad attack of measles in Tonga. And yes, Tonga. And also in Tonga, I apologize. And before that, she was the National Chief Nursing Officer and a member of the WHO Executive Board and the WHO Executive Board Rapporteur in 2020. So the floor is yours, and I apologize for just changing the O and the A, and I beg your indulgence. So thank you, Your Excellency. The floor is yours. Thank you for your time and your commitment.
Now, we already have the long-term solutions for gender inequity within global health and health systems. I would like to share from my experience before I come to WHO. And I have been involved in a lot of women empowerment, women leadership empowerment, and empowerment of youth and girls, and of course, population at large. I use the acronym of NOW, N-O-W, to share my perspectives. N stands for now is the right time. To speed, we need to accelerate. Promotion of already huge numbers of women within global health, within health systems, to leadership positions. We have that responsibility right now in our hands to deliver on that. And I speak on that because given my experience on the ground, I have met many women, nurses and midwives inclusive, During the COVID-19 pandemic, I call on local scientists, chief medical officers, environmental health staff, people who work at biomedical with the instruments and that support the health system. Most of them were women. Most of them have the capability to lead health systems. What are we waiting for? We need to do the right thing now to build the right foundation for our very own children. For the future, I dream that my daughter will not come to the leadership policy table and her voice is ignored. Her voice is subsided. She's expected not to speak at the policy table. I expect her and her voice to be respected, valued, and contribute to a fairer and better function healthcare systems of the future. Now is the time. In my experience, a lot of men, powerful men, have supported me. So I call upon all the men who are in the room to scale up, speed, and accelerate. The gap is 45, as we hear from Dr. Rupa. Women in leadership only at 25%, and they compose about 70%. What are we doing about that? What are we doing about that? How do we see 2024, 2025, 2030? Are we going to have a slight movement, 27% by 2024, and maybe by 2030, 35? We need to really think about how we can scale up and speed, because we have existing resources in our hands to put to leadership positions, and it is within our power to promote women to leadership positions. That's the N. O stands for what I have always thought about in the context of Tonga, is to prepare ocean of leaders for tomorrow. Women leaders, nurses, and midwives. We need world-class education system to prepare them to lead better than myself. That's what I challenge myself. I have to prepare ocean of leaders who will lead far better than myself, to have more influence, more impact at the policy table, because women and vulnerable populations are dying out there. And the ocean, I mean, because I have been at the policy table all my life within my career. I have been the youngest at the table, the only female from day one when I started as in charge of the surgical ward in Tonga, up to when I became chief nurse and executive within the Ministry of Health, and when I sit in cabinet and the Legislative Assembly. I said to myself, women, less than 10% here, we need to correct it. We need to produce, be able to empower future leaders, many more of that, so that they can sit at all levels within the system, because when you sit there alone, it's a very lonely journey. You are challenged with the most powerful, you're challenged left, right, and center, and you have headwinds every day within the meetings. So in order for women to be more effective and influence the table, there needs to be many of them. I said to myself, I'm the only one, 12 ministers. There need to be 6 or 7 of us. The last one is the W, working seamlessly together. And I've been thinking hard about it. The need that we connect grassroots to politicians. And nurses and midwives deliver care and are at the first contact and has the highest contacts with patients and communities. They need to be empowered to deliver care and to deliver competent, compassionate, and respectful care to the population. For me, everything is about population, enhancing and empowering the population. Once we align well on the grassroots level with the population, they will sing our song. And for me, most of what is between grassroots and politician will mostly automatically align. That is how I see from my experience. I would like to say thank you for the opportunity to be here with you. And I call upon all of us to scale up our actions wherever we are, to amplify our voices and support women of the future and deliver at the grassroots to influence leaders of today and leaders of tomorrow. I thank you, Chair.
Thank you so much, Your Excellency, for your insightful and inspiring words. And I love the acronym now, and I'm sure everybody in the room. And it's a very practical acronym, which we can all put in our daily life and practice. So thank you so much for your wealth of knowledge, your time, and your compassion and passion. Thank you. So now, moving on, we have Ms. Catherine Mengaini, who is a chapter leader of WGH in Kenya. And she has a BS in nursing and is currently pursuing her master's in the field of epi and laboratory training in Kenya. And she's been working for a long time at different levels, more than 15 years. And she works on gender-based violence and sexual and reproductive health. Thank you so much for being with us today. The floor is yours. Thank you.
Thank you so much. And I think I'm the very luckiest person in this room, standing or talking after very great women, being mentors to me. So I count myself lucky. I am a nurse. I'm a frontline healthcare worker. And I think today I'll twitch it a bit and ask myself, what is my story? Because during COVID, I got COVID. And I know that is the time where we were running away from two great words. One, being a contact. Two, getting positive results. This day, I'm called and told, you are a contact to somebody a healthcare worker who got COVID. So everything rings in my mind. I have already gone to my house. My children are there. The family is there. My work is there. The community is there. So whom do I speak to? Because everybody feels it's something so deadly and nobody wants to come close to you and have this discussion. Then the worst thing is, okay, I was so lucky at that time, home-based care had been introduced. The director of nursing services in Kenya had already put up a concept of picking up and starting home-based care for the positive cases of COVID. We get the laboratory people coming to my home and now convincing my children that all of you have to take a COVID test because of me. They're very young, they're very innocent, so it's a matter of I have to cry and convince them, and they're in tears wanting to see, why should I take a COVID test and I didn't go to hospital? We've been playing all over. Schools had closed, but they had to take a COVID test. Then you find out you are the only one in that homestead who has COVID, but the children do not have. So it's lucky you are celebrating. It comes in now, you have to lock yourself in one room and the children are staying outside. Already it's completely stigma. You've locked yourself and you have to get food. Now, the key thing that made me realize how are we prepared to listen to the voice of frontline healthcare workers, the nurses who are working, the healthcare, the doctors, the clinical officers, the women healthcare workers, and have their voice. Because when I reached out to the people, I call them, in Kenya, we call them boda boda. They are the motorbike riders, because we needed to have food and we were locked in a home where we couldn't come out. One of them had already been told, Catherine has COVID. And he told me, as I called him, I cannot bring you food because apparently you are the person talking about COVID and now I hear you have COVID. So get somebody else to bring you food. So it was so traumatic picking food from the gate. Like people are bringing food, they just put it at the gate and you come and pick it and go to the house because everybody has fear on reaching out to you. Now the question that comes in my mind, I have been a frontline healthcare worker and I did not mind getting close to the community members. But now when it strikes me, who is there to hold my hand and help me go through this journey? So what are these strategies in place just to listen to the frontline healthcare workers as they're taking care of their patients, taking care of the community? Who is there to listen and take care of them? So it was a very traumatic moment for even my family. When the second test was done, my son was asking, Mom, we are crossing fingers that it turns to be negative. Because even them, they want to move out and play, and their fellow children will tell them, we cannot play with you because we have heard that your mom has COVID. So already it stuck to the children, sticking to myself. Now we ask ourselves, whom do we run to? So at this moment, I keep on asking myself, women frontline healthcare workers are very critical. I know it would have been easy for a man because a man will go out, but you're the person who needs to make sure the children are eating, you're staying with them. So the key point was I want to cook for them. I will tell them, go away from the kitchen. I am now entering the kitchen to cook. After I finish cooking, I am going to the room. Now you can go and serve yourself and eat. And it took us almost 7 days doing that. So that was the worst ever moment in my life. And that is the time I asked myself 1,001 questions. One was, who is taking care of my mental health? Do I have a voice as a female healthcare worker for everybody to listen and ask me, how are you feeling today? How have you woken up? How are you holding on? The checks were there. A repeat COVID test is done. My kids were like, Mom, please don't go for it. Just accept you're healed. So I ask myself right now, emergency preparedness. Are we preparing ourselves to look at the healthcare workers, the nurses and midwives who work as front-end healthcare workers at the lowest level of care? Because the lowest level of care is when we interact with the community 100%. And then these are the community members who know you and know our behavior. So let us have, I always say we need to have a conversation that will spike up and ask people, as policies are being made, what is the voice of the frontline healthcare worker? Do we listen to them, or we put up policies that at the end of the day, they do not reach out to us, or we are not educated enough to know what should I do in different circumstances? So it is a very good conversation. And I think I will not stop without mentioning one thing, because I am a gender-based violence. I do a lot of advocacy on gender-based violence because I have had nurses and midwives talk about being harassed, sexually abused, assaulted by not only the fellow healthcare workers at the workplace, but even community members. So who is having their voice? So I will say I really appreciate having met Rupa and starting Women in Global Health Kenya chapter. because it has made me look at it on a different angle. As a healthcare worker, as a person the wearer of the shoe, my voice is very critical because I can speak as an angle of a woman and the angle of being a healthcare provider, being a nurse and midwife at that lower level of care. Thank you.
Thank you so much, Ms. Menganai. And I would also like to thank Norway for your staunch support because we couldn't do it without all of you. So thank you so much. And before I call upon our next round of speakers, may I request you all to please take your seats and I will call upon the next round of speakers. And you spoke something about mental health. There's a burnout, and I just wanted to share that one of my colleagues in one of the busiest emergency hospitals in New York during COVID, she was so burnt out, she could not get the care she needed. She committed suicide because she was depressed. So, yes, the reason I am not saying this to scare everybody, but these are the actual things. And that's why everybody in this room is so committed, because we should not lose another healthcare worker due to mental health anguish. And also, thank you so much for talking about the discrimination and the marginalization faced. And in India, there was a young doctor was killed by the patient's relatives because the patient died. Just happened 2 weeks ago. So my question to all of you, distinguished excellencies, all protocols observed, ladies, gentlemen, movers and shakers, we need to stop this. Because if we don't protect our healthcare workers, I'm not saying it because a lot of us are healthcare workers, we cannot move forward and we cannot reach our agenda of 2020 of leaving no one behind. So again, thank you for your commitments. And now it gives me great privilege to invite our next round of panelists. Dr. Catherine Loftus, Permanent Secretary at the Norwegian Ministry of Health and Care Services. Thank you, please. As Secretary General, she is the ministry's highest permanent official and minister's closest colleague and advisor, both regarding technical and policy matters. Thank you so much. And she's a certified physician. Now, I'm going to change the order a little because I would like to invite His Excellency Ambassador Fernando Espinosa Oliveira, Deputy PR of the Mission of Mexico to UN Geneva. And he has been in the Mexican Foreign Service for more than a quarter century. And he is a former professor in public and private international law. Your Excellency, please join us. And last but never least, the Honorable Ms. Ana Estela Haddad, Vice Minister for Information and Digital Health of the Ministry of Health of Brazil. She has held many distinguished positions and is a full professor in the Faculty of Dentistry in Brazil. Your Excellency, and the reason I changed the order is because we believe in gender parity. So we had our esteemed minister come, and then, in between, you're like the jelly between the bread. So, sir, thank you so much for your indulgence. So, now, I would really like to first call upon you, Dr. Lothars, for your intervention and your remarks. And thank you again for joining us.
Sorry to interrupt. Press this button, yes, and then I will turn green, and then hold it relatively close to your face so that also the people might hear.
This one, yes.
Okay, thank you. Is this okay?
Perfect.
Okay, thank you. And thank you for inviting me, and thank you for this event. Health workers are the backbone of our health and care services. Adequate and competent personnel are vital for hospitals and municipalities to be able to provide high quality health and care services. Without health workers, no universal health coverage. In many countries, the pressure on personnel in the health and care services has increased significantly in recent years. Like other countries, also Norway faces major challenge with recruiting and retaining personnel. Section 24 in the Norwegian Equality and Discrimination Act requires that public authorities, including public health and care institutions, I quote, must work all their activities actively, purposefully, and systematically to promote equality and prevent discrimination. Compliance with this Section 24 of the Equality and Discrimination Act is basically a management responsibility. In order to increase the probability of success, it is nevertheless crucial that employees in the health and care sector have basic diversity, equality, and discrimination skills, and the ability to relate this to their work. Women's participation rates are high in Norway, and their working hours are increasing. Health and care services are dominated by women, both in the workplace and as caregivers who look after and care for their next in kind. Gender equity is important when we develop our recruitment and retention policies. There is an uneven gender distribution among personnel in several healthcare personnel groups, and in particular in leadership. We need more women leaders at all levels. A systematic review published in February points to three crucial factors that impact retention points, and that is job satisfaction, career development, and work-life balance. Several studies include female gender and paternalistic leadership as push factors among those who leave our sector. There are important gender dimensions that need to be taken into account as we develop our policies. For example, the fact that many women work voluntarily and involuntarily part-time, and that sick leave is higher among women in the health and care sector than among men. Paternal leave when you have a child and paid leave when your children are sick are considered as important factors for an equality-friendly labor market. So we need to identify the reasons for inequality and identify reasons for part-time positions within the various professions. In particular, if part-time work is voluntary or compulsory. Structural changes to reduce the use of unwanted part-time employment must be identified and implemented. And linear career paths are not necessarily suitable for women. We must identify career paths for women across professions and work to adapt them to the individual life course and situation. And to be a bit personal and have a personal perspective in the end, as Dr. Amelia said, I have also been the youngest and sitting around a table with only men. So I have extensive experience in different leadership roles in the Norwegian healthcare system, and I know that women around the decision table is a prerequisite to move the agenda of gender equity in the health workforce for health system strengthening forward. Thank you.
Thank you so much, Dr. Loftus, for your very practical remarks. And you talked about work-life balance, which I think a lot of women need to know. And I think one of the things we have been promoting nowadays in the US is also, especially for women, and help so that for burnout. And yoga is a great therapy because you relax and you have to do it. So thank you again. And thank you so much for your country's commitment. We all could not do it without all your country's commitments. Thank you so much. Our next speaker, moving on, I would like to invite His Excellency Ambassador Fernando Espino Oliveira please to give your valuable remarks. And again, we thank you, sir, so much for your country's commitment and yours, and your fabulous colleagues' commitment. So thank you so much for your time.
Well, thank you, Dr. Rupa Dutt, Executive Director of Women in Global Health, for organizing this event. First of all, I would like to say it's really an honor to be here sharing the panel with such distinguished delegates from Norway, Brazil, and to learn how your countries are also working to achieve gender equity on the health sector. And since you mentioned reveal a secret of my 25 years of experience at working at the Foreign Affairs Ministry, well, I would like to share something personal also with you, since first of all, it was very inspiring to hear from the previous panel. Very, very inspiring, and I really feel moved, because since we are talking about how things should be changing, I remember from those 25 years when before I had my only son, it was impossible to think about something about so essential as parental leave. I had to fight that back at my ministry, but it was something unthinkable. How come, fathers should have something like parental leave? There's maternal leave. And I had to fight back at my ministry within the Foreign Service, at the Office of Human Resources. And it was after many years that we got that right, actually. And I have to say this because many people ask me, how about the involvement of Mexico on health and on gender issues? My country has officially a feminist foreign policy. They ask me, how come Mexico has a feminist foreign policy? Well, first of all, because we have so many challenges in Mexico, we have to accept that. We have to live with that. It's a reality. But precisely because of that, we are also considering that a feminist foreign policy, it's a tool where we can sort those things out, change society, change the culture, change some values. And it is not the exception on the health sector. But before going into details, since it was mentioned and very inspiring about stepping up, I have to say that in the case of Mexico, there are some results of this, I would say, cultural revolution on gender. Actually, the Mexican Congress is composed by more than 50%. I think it's 51, 52% of women now in parliament. Now, the numbers are actually increasing on women on leading positions. For instance, in my own sector, in the Foreign Affairs Service, well, the women ambassadors. We have a woman ambassador here in Geneva. We're very proud of her. And I think things are changing. And I would like to go into details about the health sector. As it was mentioned by the previous speaker, well, the COVID-19 pandemic, it was very challenging for us. Obviously, we were not prepared. And it was a stark reminder of the challenges our health sector is facing every day. And if we want to really have resilient health systems, for them to be a reality, we cannot really afford to ignore what happened on the previous years, because, we know for experience, we tend to forget about history. But we think, well, the time will change, and no. But it happens very often that we don't learn from the past experience. We tend to forget until the next crisis comes. Like some other countries, well, Mexico was particularly hit by the pandemic. Our health system, as in many other countries, was overwhelmed during the acute phase, in particular in urban areas. And health workers all over the country, they face uncertainty, work overload, and as you might be aware, as it happened in many other countries, they were exhausted. So we have to come up with some ideas. Our health authorities implemented a series of actions to try to ameliorate the conditions for the health workers, focusing on recruitment, mental health, that was extremely important. As we all know, we were all confined and people were working 24 hours a day. So health conditions were particularly challenging, and naturally, training. Many of those actions have remained in place because, as I said, well, they were put in place because of the pandemic. But once the pandemic ended, we made a evaluation and we thought, well, it should remain in place because those were valuable lessons for the future. And I would like to focus very briefly and share with you some examples of what we're doing in Mexico. First of all, recruitment. Well, what we did was to increase the number of Mexican residents in health services by approximately 13%. Maybe it's not that much, 13%, but for us was something very meaningful. And that number has been maintained, and we have plans to increase that number particularly on the impoverished areas of Mexico, considering our own challenges and our own particular differences within the country. Following WHO recommendations, we have been promoting the recruitment of young people, obviously, because they form part of human capital, like recent graduates. And in the long term, we hope that these policies will be strengthened in order to deliver better health services and try to avoid, and that is extremely important, the drain of talent. We would like them to feel motivated, to feel that they're doing something important for the society. So we would like to avoid the drain of talent. Secondly, and recognizing that women represent 70%, I repeat, 70% of the health workforce in Mexico in 2021. That's why we decided to join the Gender Equal Health and Care Workforce Initiative, promoted by France and some other countries. As part of our commitments, we have established databases to gather information about the number of women working in the health sector, including salaries, positions, and this is extremely important, in order to facilitate the reporting of sexual harassment or any kind of abuse. We have established an observatory on equality between women and men in the health sector, starting with the Ministry of Health, obviously, and promoted accountability through certifications by oversight authorities. And thirdly, in line with the feminist foreign policy approach that I mentioned about in my introductory comments, Mexico ratified the Convention 190 from ILO to eliminate violence and harassment at work, including gender-based violence. Actually, we deposited the instrument of ratification some few months ago here in Geneva. And to implement the provisions of this convention, our Ministry of Health adopted a policy to prevent sexual harassment and abuse in the health system, which is aligned actually with ILO's integrated and gender-responsive approach. So those are the few examples that we wanted to share with you. Some of them are in the early stages of implementation, but they should start actually to be showing very concrete results now. The important point is that Mexico recognizes and is fully aware of the challenges the health workers face, particularly women. So we are working to implement relevant actions in this regard. As I mentioned, the pandemic was a painful reminder that a permanent political commitment and attention to the health workforce needs are necessary, not only during health emergencies. And this is an area where delegations, WHO, and civil society can continue to collaborate and contribute to the same. I believe it was mentioned something extremely important by some of our panelists, this sense of grassroots. And yes, multilateralism should be responding to the specific needs of civil society. They shouldn't be something like a gap. That's why we are here in Geneva. That's why we're working on international organizations to bring some very concrete results for the grassroots, for the civil population. So my country is fully committed to this task. And thank you very much once again for this kind invitation. Thank you.
Thank you so much. Thank you so much, Your Excellency. Thank you for your advocacy work. On behalf of the whole team and myself personally, I would like to applaud you for your fight for the paternity leave, which is so important. Thank you so much. And I'm sure your son will be happy that you did it. Thank you so much. And now, I will turn to the Honorable Minister Haddad. Thank you so much for your intervention, and we eagerly look forward to hearing from you. And thank you again to your country, Brazil, and you. And we love Brazil. We were there for the Olympics. Thank you for hosting it so well.
Well, thank you so much for this warm reception. I'm very honored to be here. And I bring the consideration and esteem from our minister, Nízia Trindade. Actually, she's our first woman Ministry of Health in Brazil, thanks to President Lula. So we have a new government this year, pretty much different from the other one that we had during pandemics, you know. And well, I've written some words. I'm sorry because I'm not so fluent. So it's just for me not to lose. And I think that the things I prepared to say have been already said. And I must say that I'm very, I'm touched by a profound sense of empathy with all of you here. And the stories that you told about you were so touching for me. And I'm very grateful to be here today. Oh, just a minute, please. Well, it's with a profound sense of responsibility that I stand before you today to address this issue that is not critical only for health workforce, but for our society as a whole, that is gender equity. Gender equity is a fundamental human right and also the foundation of a prosperous and modern society. Unfortunately, it's still a fact that many women and girls and LGBTQ+ community face barriers to full participation in a sector of society, including the health sector. In Brazil, the health workforce is predominantly composed of women, as many other countries. We have 3 million health professionals, our workforce, and 75% are women. So these women, tireless and dedicated workers, are the cornerstone of our health system. They are nurses, doctors, technicians, administrators, and support staff, essential for providing quality health care to our population. However, despite the invaluable importance of their roles, they often face discrimination, receive lower wages than their male colleagues, and are expected to balance professional responsibility with family care. Gender socialization permeates both the productive and reproductive spheres in these women's lives, especially those who are part of the working class. The situations coupled with precarious bonds that characterize, for example, the work of community health workers. We have 300,000 community health workers that are a very important workforce for our unique health system, SUS. It's fundamental to consider, especially when analyzing work in health, the overlap between paid and unpaid work, productive and reproductive, as mechanisms of perpetuation of women's exploitation. The ideology of gender and the subsequent naturalization of sexual division of labor often obscures these workers' awareness of the exploitation they are subject to. If we measure the time that women spend in housework compared to men, many times we work harder and harder. Brazil has been taking actions to promote gender equity in healthcare workforce, aiming to improving the response to pandemics, as well as actions to promote equity in access to service available technologies in Brazilian unified health system. The Brazilian Ministry of Health is committed to taking concrete actions. We just launched a program of gender and race equity for our health workforce. And the Ministry of Health itself, for the first time, has a woman in charge, I have said that. And I will skip a little bit just to be more. In 2023, the new government created the Digital Health Secretary in the Ministry of Health. The benefits of digital health in terms of access to health can help to assist the implementation of gender equity policies also, if we take good care of it, as, for example, equal access to healthcare actions and services. The use of digital technology can enable remote access to healthcare actions and services, overcoming geographical barriers and increasing access to healthcare for individuals regardless of gender or location. It can also prevent contamination sometimes. It's safe. Education awareness. Digital health can provide digital tools to disseminate accurate and accessible information about health issues and that directly affect women and transgender men. And we also can have a personalized medical care. Digital health allows for customization of medical care based on the specific needs of each individual and so on. These are some actions that are beginning, or we are tackling gender inequity is not a one-time initiative, but a continuous process that requires ongoing commitment, reflection, and adjustment. We all have a role to play in this, and I can all stakeholders in our health sector and beyond to join us in this crucial endeavor. Achieving gender equity is in our health workforce will not only improve the lives and health of all different gender identities, but will also strengthen our health system, our economy, and our society. The time for change is now. Thank you.
Thank you so much, Your Excellency, Vice Minister, and thank you for educating all of us about a different aspect of the power of digital health in promoting gender equity. Thank you so much. So please join me in giving the first round and the second round of speakers a big round of applause before we move on. The program has not ended. We are moving on. Thank you so much. May I kindly request you to take your seats? Thank you again. It was such an honor and privilege to interact with all of you. Now, I would like to request Mr. Frederic Depre. Did I get your last name right? Depretis? Okay, Depretis. Close enough. Thank you. I didn't ruin it, so thank you. Frederic Depretis, Deputy Director for Human Development from the French Ministry of Foreign Affairs. Thank you, Monsieur, for the support from your country and you personally. Please, we look forward to having your remarks now. Thank you.
Yeah, it's okay. Well, thank you for inviting me, honorable ministers and ambassadors, distinguished speakers and guests, dear friends, good evening. As France is a co-founder of the Gender Equal Health and Care Workforce Initiative, I have to say that it's a true pleasure to take part to this event tonight. It is also a huge satisfaction to see our initiative grow to the point that it is quoted in the G7 Global Plan for Universal Health Coverage. What a recognition! I would like to warmly thank, of course, and congratulate Women in Global Health, and particularly its Executive Director, Rupa Dutt, for extraordinary engagement and leadership. We are very proud to be part of this global effort to recognize and value the work and commitment of millions of women who make our health system work. We invite all G7 countries, and of course far beyond, because I think about the European Union countries we are working with, to join our initiative and continue our global mobilization. Through its feminist diplomacy, adopted in 2019, France is committed to promote gender equality in all its foreign actions. May it be peace and security, defense, climate and economic issues, and obviously health, both at bilateral and multilateral levels. By 2025, France is committed to ensuring that 75% of the development projects funded by the country helps to improve gender equality, and that 20% of our projects are directly focused on gender equality and women's and girls' rights, notably feminist civil society organizations. In health, French feminist diplomacy aims at providing better health services, improving understanding and training on gender issues and enhancing equal participation in health system. We promote a transformative approach to gender relations that allows for the evolution of social representations and practices related to gender identity in health systems. Our goal is to help countries strengthen the health system and achieve universal health coverage in order to provide all people, especially the most vulnerable ones, with quality health services. I think these objectives are shared by everyone in this room. But the true questions are, how is it possible to strengthen human resources for health when gender biases, discrimination, and gender inequalities are systemic in health systems? How is it possible to strengthen human resources for health when female health workers face systemic sexual harassment and violence, causing harm, ill health, attrition, and stress, as previously stated? How can we address the 10 million health workers shortfall when gender pay gap in health sector is around 25%, higher than average for other sectors? We do believe that we, as international partners, have a huge responsibility to make sure that our actions contribute to a true and dynamic strengthening of national health systems while making gender equality a top priority. Both are working together. This is indeed a timely discussion. You all know that the international community is currently reflecting on new mechanisms to better prepare for and respond to future pandemics. We consider that the creation of a new international agreement to fight pandemics is a huge opportunity to better protect and support frontline workers. They are the ones building a bond of trust with populations and communities. They are the ones risking their health and life. A majority of those are women. This is why France is strongly committed to support the integration of a systematic gender equality approach in the negotiations. This should include access to adequate and adapted pandemic response products for health workers, the training of adequate numbers of health workers, including community health workers, equipped with public health core competencies, better opportunities and working environments for women to ensure their role and leadership in the health sector with a view to increasing the meaningful representation. Strengthening human resources for health is one of the top priorities of France's new global health strategy. We shall reinforce our action to create more initial and life learning opportunities to improve working environment, to address labor market constraints. We should help government to implement efficient public policies to close the gaps of health workforce. For that action, gender equality will be our compass. We will make sure that every action will promote gender equality. This is our commitment as a country with a feminist diplomacy. This is our engagement as a proud member of the Gender Equal Health and Care Workforce Initiative. Once again, I would like to thank Women in Global Health for their extraordinary engagement and invite our friends and partners to join us. Thank you very much.
Thank you so much, sir, for your very, you wove a beautiful tapestry for us because you put in you covered everything. It was like a three-dimensional puzzle because you brought in peace and security and linked it up to health. And thank you for that beautiful term of feminist diplomacy. I think more countries should adopt it. Thank you again so much. And may I request you to take
Thank you.
your seat?
Just a word, as you mentioned, the Olympic Games.
Yes.
You went to Rio.
Yes.
So you're welcome to
France.
the
Yes,
coming
you bet.
French Olympic.
Yes.
And they will be placed under the banner of gender equality.
Yes, we will be there. Thank you. Thank you so much. Thank you. I know that. So I just want to say that, we started a little late. So I am keeping to time. Everybody who's worked with me knows I'm like a stickler for time. So I would like to invite remarks from the floor. Each of you have like 75 seconds to make a remark, or 90. And the reason we learned so much from all our esteemed speakers, so we would just have about between 75 to 90 seconds to make your interventions before we have another fabulous speaker whom some of us have had the privilege to know for a long time. And it'll be an honor to introduce her to you, and you'll see why we all like working with her. So now I would like to invite Dr. Rana Hajay, WHO EMRO, to make your remarks from the floor. Thank you. Thank you, Dr. Hajay, for coming. We appreciate you.
It's okay. Yes, thank you very much. Thank you for organizing this event. I was here actually just 4 months ago because there was another event also kindly co-sponsored by France. So merci bien. I think this is really important to bring us here together. Timing is tight. What I would really like to highlight is the situation in our region, which is the Eastern Mediterranean region. It's a region that is, this region covers 22 countries, and mostly in the Arab world, MENA, many of you know as MENA, but also we have Pakistan, Afghanistan, and Iran. And what I would like to highlight is the emergency context, because I think some of the issues that we are discussing in terms of the health workforce and the impact of emergencies on health workforce are even more accentuated in emergency settings. Since timing is tight, I want to mention specifically, for example, what's happening now in Sudan. This is the most acute crisis we are going through, where actually healthcare facilities and healthcare workers are being targeted by some of these attacks. So when we talk about, of course, and since the focus is also on the gender equity issues, in these situations, in emergency situations, gender also plays a major role, because there's a discrepancy, a huge discrepancy in also how female healthcare workers are being actually affected by emergencies. In addition, to the war or fighting emergencies, we have situations like economic crisis. So crises in our regions come in all kinds and shapes. We have economic crises like the situation in Lebanon, for example, where the 40% so far of our nurses have left the country. 20% of physicians have left the country. Again, with the nursing workforce being more women are affected by that. Many of them are the breadwinners for their families, and they have to leave sometimes at suboptimal circumstances, pay, etc., because of the necessity. So my message really is to bring attention to these needs in emergencies that require special approaches, but also to take into account that we do have at WHO, there is a code of ethics actually for dealing with the health workforce and how this should be addressed, and it should focus on at least implementing some of these ethics in countries in emergencies, in addition to all the other during peacetime. So thank you again for the opportunity.
Dr. Hajay, shukran. And thank you for highlighting that, and thank you for your commitment to the women in your region. Now, I would like to call upon Mr. Howard Catton from the International Council of Nurses.
Hey, everyone. I'm a nurse, and from the International Council of Nurses, let me also just add my gratitude, recognition, acknowledgement for Women in Global Health, Rupa's leadership. We wouldn't be having these discussions at the level and the attention they are with the work of Women in Global Health. There are about 28 million nurses around the world, and 90% of them are women. We have tracked very carefully the impact of the pandemic and the physical and mental health impacts on the nursing workforce are unprecedented in terms of their scale, their impact and their damage. Just one example, our most recent survey, our associations were saying that between 40 and 80% of nurses were reporting mental health and psychological problems, distress, as a result of the pressures that they went through during the pandemic. That's driving people to leave. We estimate that an extra 2 or 3 million nurses could leave as a result of what we've called the COVID effect. There were 6 million shortage of nurses before the pandemic, add that 2 or 3 million. You'll have heard a lot this week, and no apologies to WHO colleagues in the room, heard a lot this week that the projections are that the shortage of global health workers will be down at 10 million. I'm not sure. 6 million of nurses before, the impact of the COVID effect, add another 2 or 3 million. I think I'd be very, very cautious about that particular figure. We've talked a lot about, and we know, the lack of preparedness, protection that resulted in those impacts on nurses and on women. I think that lack of protection in itself is symptomatic of deep-rooted discrimination and inequality. Do you know, we did work with WHO to try and identify how many healthcare workers had died during the pandemic. It was incredibly difficult because some countries just didn't count. The number that we came up with was 115,000 globally. I believe that's an underestimate because that work was done midway through the pandemic and it's based on about 70 or 80 countries. 250,000 or more it could be. Think about any other sector. We see if a police officer dies, outrage, rightly so, and media coverage. Where was the outrage for 115,000 at least healthcare workers? A lot of nurses are now taking strikes around the world. This isn't just a response to the pandemic. I think there's, and I'll conclude on this point, but I think it's an important point in relation to pay, because the strikes, it's not just about the pandemic experience, it's the historic undervaluing of the contribution of caring and of nursing. Nursing around the world, people are paid about the average for the economy. So a nurse is paid about the average for the economy wage, which would be, you know, a retail worker, somebody like that. It is what a nurse does to manage 30 critically ill patients with a whole load of staff that they look after as well. Does their work, their skills, their knowledge, experience, economically, is that really at the average of the economy? I think if we start to dig at that, we expose the historic lack of value as well. We need the data, we need the numbers to expose this as well. Thank you.
Thank you so much. And appreciate your bringing the attention to the lack of attention being brought when healthcare workers die in the line of duty. Thank you again. Our next speaker, moving on, is Mr. Sergi Breas from Saltus. Okay, then I'm going to move on. Yes, now we have Claudia Sizemus, who is the liaison officer for SRHR issues, including HIV/AIDS from the International Federation of Medical Students Association. We are so proud of the activism all you people are doing. Congratulations. And you have so many people here who would be willing to pass the torch to you. So thank you.
Yes, thank you. Feel free to approach us as well. So I would like to start with acknowledging and congratulating to your incredible country commitments that set the example for other countries. I actually do have a question because I do not have a solution for that, but I would like to reflect a little bit on the barriers that prevent women from reaching leadership positions that we spoke about before, but also enjoy their work environment or develop careers in the way they wish. As per the report from Women in Global Health, one of the greatest barriers is the lack of safety in the workplace. And this is not only the experience of the healthcare workforce, but this also starts in the universities. We conducted the survey where most of over 54% of students experience gender-based discrimination towards themselves. And the percentages was quite similar when it comes to witnessing discrimination on the basis of gender towards patients and teaching staff. So I would like to ask maybe one of the panelists if you know how we can ensure dignified working conditions, not only on the policy level or not only on the hospital level when it comes to accountability mechanism, but I think what's more important is the attitudes and behaviors of healthcare workforce to prevent in the first place such incidents. Thank you.
Thank you so much for your astute question. And I will just defer it to a little later because we want to keep the time. Thank you so much. And now it's my privilege and pleasure to invite Miss Lois Pace, who is the U.S. Assistant Secretary of Global Affairs, Office of the Secretary of Health and Human Services, to give the closing remarks, please, Ms. Pace. And I just want to say that she is responsible for advancing U.S. international health agenda through multilateral and bilateral forums. She leads the Office of Global Affairs, setting priorities and policies. And Lois, as we all fondly call her, Miss Pace, all protocols observed, madam.
Yes.
She served as president and executive director of the Global Health Council and was a member of the Biden-Harris Transition COVID-19 Advisory Board. And believe me, this woman was like an energizer bunny going on. We saw what she did, and some of us have had the privilege of knowing her for almost a decade. So on APHA, all of us know you, and we were so happy. And that's why I just said that, it's like you will be astonished also when you hear from what she has done. All of you are amazing. The floor is yours, Miss Pace, please.
Thank you very much, Dr. Murthy. Oh, I have to sit down. I was going to stand.
Okay, it's up to you. Please be comfortable.
Yeah.
There are no restrictions here. Thank you.
Well, thank you certainly for leading these conversations. It's really been heartening to hear from everyone who came up. I have to also embarrass Rupa, though. Dr. Dot, I guess, all protocols observed, as we've been saying, because I've known her for about a decade, and she thinks I'm going to talk about when she launched Women in Global Health. But what I'm really going to recall is how I would see you running around the Palais as an IFMSA advocate. So you too can become Rupa Dots running an organization like Women in Global Health. No, but it's really great what you've built over time and what you've built in community with others. Rupa is so modest, as I think we all know, and it's because she knows that it's not just about the power of one, but the power of many. And that gives me hope. I mean, we heard a lot today about what more needs to be done, and that's very true. I want to say something, which is we're doing it, right? We have several countries co-sponsoring this event. Rupa used to have to beg people to even show up to these things. And now, as has been said, we're talking about it. We're talking about it fluently, easily, readily, thoughtfully, because you and we have helped make that happen. So I would say give yourselves a round of applause, not just for the work we have to do, but the work we have done. Please. So I'll reflect on what I heard, and I'll maybe work my way backwards. I really liked that there were some concrete updates and ideas that came to the floor, right? And I'll package this just in terms of policies, right? Policy change. This is why we're all here. One category for me was around capacity. And sure, we talk about building capacity of the workforce, many of whom are women, let's say it plainly. But I don't want that to seem as though these women aren't showing up with the skills that they need to get the job done, right? A lot of times, I think often in these cases, capacity is also about equipping them to be able to be successful. Too often, women in the workforce, including the health workforce, are told, do more with less, figure it out. And we always do, because that's who we are. And yet, it's not right. They should be able to do more with more, right? So when I think capacity, I'm thinking not about a deficit that they have themselves, but the deficit or gap with which we've left them. And it's time for us to finally close that gap. I also heard another bucket, and a really important one throughout all of the remarks, and that was about safety. And we know this, we should keep saying it, we shouldn't have to, but no one, especially a woman in the health workforce, should be putting her body on the line to save our lives. That's just the reality. And it happens every day. It happens to some of us even in this room, more often than we even say, right? And I want to lift up the Health 2 compendium that Women in Global Health put out. I don't think they got enough responses to pull that together, but it is because those are hard stories to tell, I think. And so it's up to us to continue to shine a light on safety and protection and what these women truly need. And, I want to thank our representative from Brazil, because she spoke about another area when it came to policy and policy change, which is diversity. And sure, we talk about women being an important factor in diversity and diverse spaces, including in the workplace and workforce. But I heard you talk about women in all their diversity, including LGBTQI plus individuals. And I appreciate you for doing that because they often are forgotten. And I mean, it's just so we're so happy to have Brazil back. We experienced this 2 years ago when we had a change in government. So we can tell you're trying to speak up for these communities. Indigenous communities as well, I know, has been something that the government of Brazil and others have spoken about. And I just think we have to keep in mind women in all of these settings really needing our support, some more than others, honestly. So I won't go into much longer. Are you giving me the hook? Okay, great. But I'll speak a little bit to a couple of things, a couple of other reflections that I had listening, but that I didn't necessarily hear. And it relates to some of the work that we're even trying to do in the US government. And that's in the area of innovation, right? It's easy, I think, to talk about what women need without, like Rupa has said, calling it out. And we have this great opportunity to sort of leapfrog in this space. It's happening, right? But I worry as we talk about digital health and AI, we're not applying this gender responsive approach in a way that we've been encouraged. And so even real time, as these topics are coming up in spaces like the G20, as they're coming up in places like WHA, I just want to challenge us to always think what's missing here and what's the component around gender, specifically in gender equity that's missing here. I also, appreciated that a lot of this centered around retention, i.e., how do we keep women around? How do we make it so they want to and can continue to do this work? But it's not only about, sort of recruitment and some of the other areas I mentioned in terms of capacity and the like. It's about recognition, it's about compensation, it's about promotion. So again, being really deliberate about what keeps people in the door. Why do you show up to work every day? I mean, we all show up to work because we want to make a difference, but what keeps us there, right, are these other really explicit areas. And, beyond the applause, what's lacking and where do we need to, again, fill that gap and fill these spaces. So I want to end with where we started and where you started, ma'am. And we are just so happy to have you here. Thank you for saying yes to this role, because already we see how powerful you're going to be. But the time really is now, right? There's no time to waste and there's no reason to wait to start to move in these directions. And again, I'm really encouraged by everyone who's here today and by everything that we heard, knowing that we really all can get this done. I heard as I was walking in as well, Rupert will take away our pens if we don't show up and speak up on these issues. So she's issued a challenge. I think that challenge has been accepted. And the bottom line, for me at least, is, if we don't get this right, we all lose. It's not just the women in these roles, right? They are lifting us up. They saved us from COVID and then some, right? And so if they're not around, who and where are we? Now we can flip that, right? Because if they win, we all win. So let's do this. Thanks.
Thank you so much, Ms. Pace. That was the grand finale. And please join me in giving all our speakers a big round of applause. This was a phenomenal panel. Thank you so much, everybody, for your time. And have a good rest of your day in beautiful Geneva. Thank you again. Thank you so much. You have your card. Thank you for that excellent speech. France, yes, for supporting this work. Excellent. You should get a good photograph.